Hi everyone, Dr. Ashley Kowalski here. Today I want to talk to you about something called irritable bowel syndrome and a common reason why people have the symptoms associated with it. So irritable bowel syndrome is basically what people are given as a diagnosis when there's no other real findings or reasons to believe why these symptoms are occurring. So you may have had an endoscopy done and everything came back normal, maybe a colonoscopy and everything was fine. But the problem with this is there is still a segment of the gastrointestinal tract that has not been examined properly, and that would be your small intestine. So irritable bowel syndrome presents with symptoms of cramping that is usually relieved by defecation, changes in bowel habits and consistency. So you might go anywhere from, once a day to 5 times a day sometimes, or sometimes you might even be skipping days and going once every 3 days. And also changes in the consistency. So maybe harder stools or a little bit softer stools. So I want to talk a little bit about the common reason that people may be experiencing these symptoms, and that is called small intestinal bacterial overgrowth. So this can be detected with a lactulose breath test. So if you've been going through the motions of trying to figure out why you're having the symptoms you are having and not really getting any answers, I would suggest seeing a naturopathic doctor. And a naturopathic doctor can order a breath test for you in order to detect the presence of a bacterial overgrowth, which might be causing your symptoms. So usually, if there's a hydrogen overgrowth, people tend to have more diarrhea-like symptoms. And if there's a methane overgrowth, usually tend to be more on the constipated side, but there can be the presence of both bacteria as well. So if you have been struggling with such symptoms for a period of time and haven't been getting the answers you've been getting, I would suggest send me an email and book an appointment with your naturopathic doctor today, and I'd be happy to help you. All right, have a great day. If you have any questions, feel free to go ahead, send me an email, or if you'd like to set up your appointment, you can do that as well.